Doctors keeping a close eye on yet another COVID variant.
The Delta variant wreaking havoc worldwide, especially with Europe and India and even in Africa.
And gaining a foothold in the United States. Health experts say it's the third most common coronavirus variant they're seeing right now.
Much more contagious than just the regular old virus that hit us really hard back in January and February.
The concern with even easier transmissibility being the Delta variant could make it so we see more people getting the virus and opportunities for it to mutate into something even more dangerous.
This Delta variant can turn into something it may have already that is much more resistant to all of the vaccines, and we just haven't seen that particular strain come through yet.
Which is why doctors are, again, encouraging people to get vaccinated if they haven't already, and to get their second dose if they've only received one dose of the Moderna or Pfizer vaccine.
The number they give out is 87.9% protection, even against the Delta variant. So we're very well protected against the Delta variant with our vaccine. But if you only have one shot of the Pfizer vaccine, it's only 33.5% protection.
Dr. Vaughn says the groups of people not yet vaccinated fall into a few different camps. There's one group.
We have people who are just dead set against it because of what they heard from their friend or what they read on Facebook.
But it's a second group Dr. Vaughn and his colleagues are trying to reach with information about how the vaccine can help provide protection against that Delta variant.
The ones that it's more apathy. They're just not motivated to go do it. You try to talk to them about the benefits of it. They don't want to hear it. They just don't care. Those are the ones that I want to work on the most.
So they'll share concerns with patients.
It's still out there. People are still getting it. People are still spreading it, and people are still dying from it. Hundreds per day in the United States.
And talk about community responsibility, hoping to reach people still on the fence about getting their COVID shots.
We're all in this together, and it's very possible, even though you're not worried about getting it yourself and getting sick, it's the person who gets it from you who may be vulnerable and get sick.
Melanie Wingo, KCRA 3 News.